Hello, everyone. Welcome back to class. Hope you're doing well. We've got a short lecture for today. First off, I have completed the week 7 homework. Good work on that. Again, the whole purpose of that assignment was to practice reviewing a manuscript and to do so using the Centers for Evidence-Based Medicine criteria. Now, you don't have to utilize that criteria, but I think it is a nice framework to think about things as you critique an article. So, do people usually print out that CEBM and check off things and make sure that they've addressed everything when they're critiquing something for a review article? No, no, they don't do that. But I think if you think about those general domains, it helps you to compare and contrast against other research. And when you do critique articles, obviously that's going to be used within your dissertation, within the paper that you write, and within the poster that you create for the symposium. And you can also obviously use this information as part of your literature review assignment. So that major assignment 2 coming up later on at the end of the term. And note that not all details are necessary to include when writing a review article. For example, discussions around the randomization process aren't necessary. Where it becomes necessary, and let me reiterate, um, do they use a random number generator? Do they flip a coin? That type of stuff isn't necessary. Where you might talk about things in the discussion section would be around any weaknesses of articles that didn't use a randomized controlled trial design. It's not uncommon for a case series or a one group cohort or a quasi-experimental study to have significant findings between groups. However, when randomization occurs, those findings go away. So that's something for consideration there. This week, we are looking at this screencast, Tips for Writing an Introduction section. And there is no homework this week, so it gives you an opportunity to just spend time writing toward major assignment 1. Also, next week will be a full week devoted to working on major assignment 1. And then recall going back to week number 2, that's where we presented the major assignment 1. And within that week's module, there are a couple student examples, again, to help guide you, to help you appreciate the overall length or what we're going for. Again, if you have any questions, please let me know. I'd be happy to discuss those with you. So, again, examples of the PICO assignments can be found in that week number 2. Here is a little component of one of those where we see a 1-paragraph introduction and then a presentation of the PICO question. Now, this week we're talking about writing an introduction section. Now, for your PICO assignment, this doesn't have to be too long. This doesn't have to be fleshed out in great detail. Ultimately, you'll probably have multiple paragraphs, 3, 4, 5 even, in your dissertation. But what I want to do this week is talk about some strategies, what goes into that introduction section. So we're going to explore a general approach. You might be also to find some examples, some tutorials on YouTube. And we're going to review an introduction section from a systematic review. And I think what's valuable about when you think about your introduction section, it's setting the stage. It's getting ready to tell your story, why your research in the form of a systematic review or a scoping review is necessary. Now, looking at a general approach here, and as we look at this here, keep in the context or keep in mind that I'm not asking you for major assignment 1 to have a 4-paragraph introduction section. It can be shorter. If you turn in something that's longer, that's fine. That's just work that's helping you prepare for your different dissertation drafts. But the general approach is identifying the problem. And you'll see that in a lot of articles. In that first paragraph, it'll start off by describing condition X, and then noting maybe things like the prevalence or the incidence of condition X in the population, and how condition X impacts individuals who develop that disease. Paragraph 2 will start to talk about what is known about that topic already. And a lot of things have treatments in place. And so you might have a paragraph that talks about the standard treatments for this patient population include medication A and or medication B. Maybe you spend a couple lines talking about how medication A is administered, how medication B is administered, or maybe describing their drug classifications. And then ultimately, you're going to want to highlight why there is potentially the need for something different as a treatment. So, for example, it might be, however, these medications have side effects, or could be, however, these medications are very expensive. Paragraph 3 then would be what is known about the intervention. Newer drugs have been designed and they have shown promise in early stages. They have shown fewer side effects. And then so the purpose of this paper is then to, and in the context of what we're doing, we would probably, in this type of example, want to compare any types of research that's out there, especially randomized control trials, comparing the efficacy of the new intervention versus the prior interventions. As I've had great conversations with many of you in the past couple weeks, the volume of research and the types of research that are available will help you know whether you need to do a systematic review or a scoping review. And so in this particular example here, let's say there were 8 papers that were reporting the efficacy or the effectiveness of the newer drug versus prior drugs. Well, then you might go with a systematic review. But let's say the newer drug has not had many trials against other drugs. Well, maybe you would have in your scoping review a section related to the side effects or lack of side effects for people who take the drug. And maybe you would have a paragraph associated with outcomes. And then maybe you could have a final paragraph related to any research that reports comparisons between the newer drug and the older drugs. And in that, because of the diversity of topics, the diversity of research questions trying to be answered, you would probably want to go with a scoping review. Here's an example of a systematic review. Something from my world. We can see the guy there doing a squat, doing the squat with blood flow restriction training or that occlusion cuff applied to the proximal thigh, just on one side. But what this particular systematic review is it looking at the effects of blood flow restriction training on quadriceps muscle atrophy and circumference after an ACL reconstruction. And I'm not going to read through the whole introduction here, but this can give you a nice idea. You can read through it. What I've got bulleted, or not bulleted, what I've got arrows pointing to are components of each paragraph that move the story along. So, for example, at the end of the first paragraph there, it's highlighting that people continue to have weakness and decreased cross-sectional area of the muscle many months after surgery. Next paragraph highlights why quadricep dysfunction or quadricep weakness is an issue. The third paragraph spends time talking about what has been done in the past, or what is the current standard of practice for working with patients that have persistent quadriceps atrophy. The fourth paragraph talks about then blood flow restriction training and gives us information in the fourth paragraph and the fifth paragraph about how it could potentially be a benefit. And then finally, we get to the final paragraph and it gives us information on the purpose of this systematic review. So this is a nicely laid out one here from the sports medicine or rehabilitation world. Looking at something here that has applications to primary care as well as the registered dietitian world. What's the layout? Again, a similar layout, and I won't read through all of this, but I would recommend you taking the time, pausing the recording, and just getting a flavor for it by reading through it. So in this introduction here, they're highlighting the changes in demographics of individuals greater than the age of 65, and then highlighting that there are age-related diseases associated with this population and how those diseases have an impact upon health. Continuing on, making discussions around the area of the Mediterranean diet and how the Mediterranean diet may help to reduce the risk of chronic diseases. And so it gives some explanations as to why. Paragraph 3, discussing that there are literature gaps. And so that's the purpose of the systematic review, to explore the association between the Mediterranean dietary pattern and inflammation in older adults. Okay, so there's no homework this week and no forums. Again, if you want to meet up, that would be great. If you want me to review your introduction section, just email it to me. Obviously, email it to me before you turn in your major assignment 1. And with the examples that are shown here, or any of the examples that you might find pulling up systematic reviews or scoping reviews, look for that flow. Again, think about it as a story and tie it back into your PICO. What is the problem? What is currently done for that problem, to address that problem? What is the potential new treatment, or what is the different way of doing things? And then your final paragraph, the purpose of this study is to do X, Y, or Z. All right, that is the last slide. So again, as a reminder, this week we're just having this short little screencast here. You have the week to work on your major assignment 1. Next week is also devoted to major assignment 1. There will be no screencast. I will check in via email through Canvas, but there will be no screencast. Have a great week, and I look forward to continuing conversations with you.